Hello everyone. The video today is about a couple of questions around heavy metal treatment, toxicity, things like that, and also a question about the safety of bismuth. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So I posted a video a couple of weeks ago. It was called Case Example Successful Heavy Metals Treatment. And in that video, I talked about a case example of successfully treating someone with heavy metals. So one of the questions, one of the questions in the comment section was, is bismuth a dangerous heavy metal? It is used to combat phase 2 biofilms. Is it a potentially dangerous treatment? So really good question. And as always, please talk to your healthcare provider to get specific advice for you. But with bismuth, so bismuth is a metal, but it's not. It is not a toxic compound to use in certain forms. So there's two main forms of bismuth that I'm aware of anyways that are used therapeutically. One is bismuth subsalicylate, the other one's bismuth subnitrate. To my understanding, bismuth subsalicylate is sometimes associated with having a neurotoxic effect. So if there's too much of that being consumed for too long a period of time, it could potentially cause some peripheral nerve damage, which is obviously not good. Now, my understanding is plenty of folks can use bismuth subsalicylate and not have nerve damage, but it is a possible side effect. The other form, bismuth subnitrate, which in my experience is typically the form that's used to disrupt phase 2 biofilms, that form does not have the same toxicity profile. I've recommended bismuth subnitrate to many patients over the course of time, and quite frankly, like the dosages that we use in the phase 2 biofilm disruption is quite a bit lower than the dose that we use when we're treating SIBO. There's a subtype of SIBO called hydrogen sulfide gas-producing SIBO being small intestine bacterial overgrowth, and we use quite a bit higher dose of that, and sometimes for like a couple of months at a time. I've never seen any neuropathy with the bismuth subnitrate, so definitely something to have on the radar, but I think it's generally quite a safe treatment. So thank you for that question. And then somebody posted a few questions on this video, and so I'm just going to try to rapid fire through them here. So it says here, it is recommended to add in liposomal glutathione during IV/oral EDTA treatment. If so, what dosage is recommended? So unfortunately, just on social media, I can't give out any dosages, just not something that I'm allowed to do per my regulatory college, and just quite frankly, especially in the realm of complex chronic illness, it is really better option to work with someone who can give you specific advice. So, working with your clinician or whatnot. So sorry, I can't give specific advice around that, but I did just want to emphasize, as I said, apparently at minute number 8 in this other video, because they timestamped it, that adding an oral liposomal glutathione is really important, and that not all forms of oral of liposomal glutathione are created equal. I've found that certain brands don't really seem to work all that well. Certain brands seem to work very well. The brand that I'm the biggest fan of is this company called Designs for Health. They use the same, my understanding is that the glutathione they use is actually produced by the lab Quicksilver Scientific, so I believe that's the exact same product. So Quicksilver makes it, but Designs for Health distributes it under their label as well. And then the company Research Nutritionals, they have a product called, I believe it's Trifortify Glutathione. I've seen that one work quite well too. I'm certainly not saying those are the only ones that can work, but of the ones that I've seen, those are ones that I can personally vouch for. Another question from this individual was, have you had good success treating brain fog/cognitive impairment by heavy metals chelation? So as I mentioned in this video, this successful treatment of heavy metals are oftentimes interplaying with other things as well. So a person with brain fog and heavy metals might not see a notable change or meaningful change with their brain fog levels until other things are resolved. As I mentioned in this video, I find that heavy metals tend to be kind of a stumbling block, or I should say like an obstacle that stands in the way to folks getting 100% better. And sometimes we don't really see much improvement or very quick improvement until we get those heavy metals out of the way. So I have had some patients where when we work on their heavy metal level reduction, it does have a really significant impact on helping with their brain fog and cognitive function. But there's oftentimes other things going on too. So if I had a patient who had elevated metals, cognitive dysfunction, brain fog, I'd be thinking, well, probably want to get rid of the metals, but if their cognitive function was not improving very quickly, I'd be looking at other things that might be contributing to that symptom as well. Then let's see here. The last one here, it says semi-slurred speech, shortness of breath, cognition worse than an 80-year-old. And just to say, in defense of 80-year-olds, I know some pretty darn sharp and sprightly 80-year-olds. But I get where you're coming from. Anyways, no short-term memory, anxiety, depression, skin rashes, candida symptoms, chronic fatigue, all this with eating a perfect diet, just organic meat and fruit, low amount of rice over the last 6 months. Been sick for around 4 years, horrible brain fog no matter what. And then kind of goes on here to say, I don't know where I got all these heavy metals from, but ultimately wondering about the Andrew Cutler or Andy Cutler, can't remember what he goes by, Andy Cutler protocol, where he says he doesn't recommend intravenous chelation, just alpha lipoic acid and DMSA, and very low doses, no less, for the DMSA. So I have posted actually about the Andy Cutler protocol a little bit. I don't think I have any videos that are entitled Andy Cutler protocol, but I have at least one, if not two videos, which the title is something to the effect of, is chelation therapy dangerous? And I believe I kind of touch on that. There are folks out there who talk about chelation being really, really dangerous, and I just have not seen that in my practice. They talk about folks having sometimes like horrendous, like permanent, awful results from chelation therapy, and I haven't seen that in my practice. I've had one patient to date where they are sort of attributing those some worsening symptoms, to chelation therapy. In my opinion, with that case, there were other variables that were at play, so I don't think that it's something that I feel like even in that case where it's kind of a maybe, I feel like there are other, more plausible explanations for that. So I really haven't seen like these, terrible, debilitating, detrimental effects from chelation. There certainly have been some case reports of like really severe outcomes related to chelation therapy, where there have been some fatalities, but that was related to the wrong treatment being administered, or a treatment being administered the wrong way, administering a treatment like rapidly that should have been administered over hours. So like, it's tragic, a couple of case examples, but that was due to clinician grievous error, not due to the therapy itself. There are some other case reports where folks have seen reports of kidney function kidney damage, or at least reduction in kidney function, likely related to kidney damage, or elevated liver enzymes related to chelation therapy. But to my understanding, those have only been in cases where folks already had pre-existing kidney issues and the dosage wasn't being adjusted to account for that. We're always extra cautious using chelation therapy in folks with a history of kidney issues or chronic kidney disease. So it's a really that's a very sort of nuanced group, and certainly those laboratory findings don't extrapolate to the rest of the population at large. In my experience, I think chelation is incredibly safe. I haven't had any patients who have done the Andy Cutler protocol, like the alpha lipoic acid and the super low dose DMSA, where they've done like a pre and post test. So I just honestly don't know how well it works in terms of getting rid of the metals. I've certainly found that oral DMSA is something that can work very, very well to get rid of metals. It takes quite a bit longer than the IV chelation, but it gets people to the same finish line a lot of the time. So if I have patients who say, I'd really rather not do IV chelation, totally fine. We do oral chelation all the time with DMSA, and it can work just great, but I don't think it requires these super minuscule doses that some protocols advocate for. So I hope that this information was of interest to folks. I hope that the folks asking the questions got the answers that they were looking for. I appreciate the questions and the comments on the videos. Thank you for posting those things. I do my best to try to respond as best I can, but I do get quite a few comments on the videos, and I don't always have a chance to specifically, like, I'll get thank yous and this and that, and it's like, thank you so much for that, and you're very welcome. Time is limited, and I'm always kind of doing these at the end of the day, and I need to rush home to get to my family to spend some time with my kids and my wife. So thank you for the comments. Thank you for the questions. If anybody has any questions or comments on this topic or anything else, just post in the comment section below, and otherwise I will leave it there for now.